Barker.
Thank you, Madam Deputy Speaker. Well, Madam Deputy Speaker, the member for Maribyrnong just spoke about a government that is focused on strengthening universal health care, and I want to present a slightly different version of what's happening in a community not that far from Maribyrnong in south-east South Australia, my hometown of Mount Gambier. But before I do, the bill, commendably and with bipartisan support, reduces the cost to clients for filling prescriptions. And I say commendably, and of course it has the bipartisan support in this place, and those opposite spent much of last term telling us it was a real cost of living saving, and it is a cost of living saving. It's just perhaps unfortunate. At the same time, people were being told about a saving on their prescription, their energy bills were doubling and tripling, not to mention their mortgages, etc. But let's park that for a moment. Let's talk about the community of Mount Gambier. It's in my electorate of Barker. It's South Australia's second largest city, and it's not that far from Melbourne, or at least in relative terms. There are 4 clinics, Madam Deputy Speaker, and I received a call this morning from a local journalist with the ABC saying, "Mr Paston, are you aware of the circumstance where all 4 clinics in Mount Gambier have closed their books?" Now, I don't know if those opposite understand what closing their books in a medical clinic represents, but let me give you a real-world example. Your child's sick, you're new to our community, and thankfully our community is strong and vibrant and people are coming to our community. You pick up the phone and you ring clinic number 1. The first question is, "Are you a client of this practice?" "No." "Well, we can't see you. We're full." You pick up the phone, you ring clinic number 2. You're presented with the same question. Same response, same outcome. Clinic number 3. By this stage, you're probably feeling a bit stressed. But you ultimately get to clinic number 4 and they say, "Look, sorry, we've also closed our books." And those opposites will say, "That's fine, we've got a solution for communities like yours, Mr Passon. Urgent Care Clinic. We opened one of those in Mount Gambier, and true you did, those opposite. True you did, to much celebration and acclaim for the relevant minister, who himself is a South Australian, who I'm sure is aware of the community of Mount Gambier." But you know what happened in June of this year? The Urgent Care Clinic in Mount Gambier closed. It's currently closed. You can get on your device and type Urgent Care Clinic Mount Gambier, and it says temporarily closed. Now, it's been temporarily closed since June. The operator that those opposite decided should run that facility fell into administration, and the administrator, after running the troubled Urgent Care Clinic for 4 months— by the way, this Urgent Care Clinic was never open the hours that it was meant to be open, but that troubled care clinic was ultimately closed by the administrator. So in Mount Gambier, if you're looking to see a GP, you can't go to the 4 clinics, their books are closed. You can't go to the Urgent Care Clinic, it's literally closed. So what do? Well, I don't know. Because when I was asked that question by an ABC journalist today, I said, "I don't know what you do right now, but I can tell you how we've got here." And he said, "How? Why?" Well, obviously there are issues with the Urgent Care Clinic, but let me take you back to 2022. A newly crowned Labor government is elected, the Minister for Health appointed, and his very first action as the Federal Minister for Health, people of Mount Gambier do want him to help, by the way, Health, was to change the distribution priority area for GPs. Now, how is that relevant, you might say? Well, let me put it to you this way. Our nation has determined over the course of this debate, and this debate around GP shortages, and the member for Grey has joined us, and he would know more than most. This issue is as acute. In fact, it's more an issue in his electorate than it's mine. But when it's becoming an issue in places like Mount Gambier, it's an issue everywhere across regional South Australia. Like I said, Mount Gambier is the second largest city in South Australia. But we, over the course of this debate, have determined that certain areas in our country, and in the member for Grey and my case, in our state, are in need of special assistance when it comes to attracting a GP workforce. And so we've created these, if you like, special zones. And what that meant is that foreign doctors could be encouraged on visas to come to Australia, but they would need to practice inside those zones. So, as I said, the very first action for the Minister for Health in 2022 in his official capacity was to change that priority area distribution list. And what he did was he included Adelaide in that priority list. And on that day, the day that it came into effect, 2 of the 4 clinics I've mentioned earlier in my contribution, their office managers rang me and said, "Tony, we just want to tell you what the real-world impact is on the decision that's just been taken." And I said, "Don't tell me. Doctors have tendered their resignations." Exactly what had occurred. Because, of course, the only thing tying those foreign doctors to our community was the obligation that they practice in those areas. That was the point of the legislative instrument. But if you make it that Mount Gambier, Millicent, any other regional town starting with M that might be in the member for Grey's electorate is treated the same way as Adelaide, then of course the small number of GPs that we have relative to our population size are going to make that decision. Melrose, there we go. And you know where they went, these doctors? They went to Marion. Marion in Adelaide, that very, very disadvantaged local community. I mean, please. But that is the consequence here. Those opposite will get up, as the member for Maribyrnong just did, and give us a fantastic dissertation about universal health care and how important it is and how this was a great Labor legacy. What the member for Maribyrnong doesn't say that over the term of the last government, bulk billing rates actually went down. Now, I'm loath to mention bulk billing rates in my contribution because almost no one in my electorate is able to access a bulk billed GP consultation. They're very difficult to get hold of. The reality is the majority of people pay gaps, and in some cases very substantial gaps. And personally, I think it's a real flaw in this system that I could be a well-heeled individual living in a well-heeled suburb of Adelaide and drive 15 minutes to a bulk billing clinic. And I could be one of the poorest South Australians living in a very marginalised community, a long way from services otherwise, in a community like Mount Gambier where the urgent care clinic is closed and I have to fork out a $40, $50, $60, $70 gap. Someone needs to explain to me where the equity of that is, because it doesn't feel that equal or equitable to me. Now, far be it from being that member of parliament who grumpily points out all the problems, I'm going to suggest a solution if I could. And that is to undo what the Minister for Health did in 2022. He stripped Mount Gambier of its special status, and as a result, GPs left that community, a community that, as I've said previously, is the second largest in South Australia. But remove Adelaide from that distribution priority area designation. A capital city shouldn't be in that category. It's unfair to ask communities like mine to effectively compete with a city of 1.4 million people. That's the first thing the Minister for Health can do. The second thing he can do is expedite the reopening of the urgent care clinic in Mount Gambier. As I said, it's been closed since June. There is a tender process going on, but let's get it done and get it done quickly. As an aside, I should tell you that the local PHN, when they told me that they were going to allocate it to a particular individual, I warned them that I thought allocating it to an existing GP practice with limited doctor numbers was going to lead to challenges, and indeed that's what happened. But expedite the reopening of the urgent care clinic in Mount Gambier. And the final thing, and this is directed at everyone in this place, there are so many young people studying in regional South Australia. I'm sure the member for Grey knows some brilliant young students in his communities. I certainly know some of mine. I know how passionate they are about health and health-related studies. But too many of them, even with high ATARs, are culled away from the process of studying medicine because they're subjected to subjective testing, interviews in inverted commas, the GAMSAT testing for aptitude and these things. Having grown up in a regional community, having left it to study because the degree I wanted to pursue wasn't available in the community I grew up in, I can tell you that the strongest links are those familial and friend-based relationships that draw you back to a community. The member for Grey, one example. I'd suggest to you the member for Barker, another. Having got my degree, I was working in Adelaide, all my friends were living in the regions. At one point I simply walked in to the law firm I was working in, sat down with the partner I was working for and said, "I'm off home." And he said, "For how long?" And I said, "Forever." And he said, "Don't be silly, you'll be a partner of this law firm one day." And I said, "That's not where I want to be, champ. I want to be home with my people." And so I tell that example, not dissimilar to the member for Grey's experience, because young people who grow up in a regional community are much more likely to return to it after studies. So I appreciate that we're doing our best to educate young people in medicine and other health disciplines in regional communities, and that is admirable. That is admirable, and we should do more of it. But the very first thing you need to do, if you want more rural generalists to return to practising in the country, is give the opportunity to country kids. Give the opportunity to more country kids, because I'm not saying that every single one of them will return and become a local GP or even better, a specialist living in regional South Australia and operating their practice in regional South Australia. But I'm confident you massively increases the chances of that taking place. And I think it's something that we need to do more. And there's no paucity, can I tell you, of young people who are smart, with the right attitude and aptitude, living in regional communities who want to do this. So it's incumbent on all of us. We can't solve this problem long-term without more GPs. I'll end my contribution by saying, as I said at the beginning, cheaper medicines is something that has bipartisan support. I don't want to end up in a situation where the only healthcare available in some communities is your local pharmacist, but that is the case right now. I began with that new arrival to Mount Gambier, ringing with a sick child around the 4 clinics and being told there's no room at the inn. Right now, the only place they can go is their pharmacy. I'm glad they can, but it's not good enough.
Member